Namaskar, my dear students. Today in the quick review section, we will be discussing a topic of RPD, that is minor connectors. It is an important topic. It comes as a short note in the theory exam, and many MCQs are framed from this topic. The design of the minor connector, the types of the minor connector, we will be covering them all. So let's begin. First of all, what is a minor connector? The definition, it is very important. It itself comes as a multiple choice question. So minor connector, from the name itself, it is the connector, the connecting link between the major connector or the base of the removable partial denture to the other units of the prosthesis, to the other parts of the RPD, such as the clasp assembly, the indirect retainers, rests, etc. Next comes the functions of the minor connector. First is the unification and rigidity. Unification means the joining the connections, okay, and it provides the rigidity to the whole of the framework. Second is the stress distribution. The stress distribution occur in both the direction. First is from the prosthesis to the abutment. The occlusal forces which are applied onto the artificial teeth, they are transferred to the abutment throughout the arch with the help of the minor connector. And second is from the abutment to the prosthesis. It transfers the effect of retainers, rests, and the stabilizing components on the abutment to whole of the prosthesis. Third, it adds to the bracing effect of the prosthesis. And last and very important, the proximal minor connector, they help in maintaining the path of insertion of the prosthesis. Design of the minor connectors. Here are a few points which are very important when we are designing the minor connector. In that, first is that it should have sufficient bulk to be rigid so that it makes the framework rigid and all the components they work effectively. Second is it should be located in the embrasure area. When contacting on the axial surface, it should not be located on the convex surface, but instead it should be located in the embrasure area where it will be least noticeable to the tongue. Third, it should be thickest towards the lingual surface. That means it should be tapering towards the contact area, as we can see in the picture also. Next, it should form a right angle with the major connector so that the gingival crossing, which is abrupt, and it covers as little gingival tissue as possible. Last, very important, the sharp angles should be avoided and the spaces should not exist for trapping of the food debris. Next comes the classification or the types of the minor connector depending on what it is connecting. First, the type of the minor connector which join the clasp assembly to the major connector. Second type are they join the indirect retainers and the auxiliary rest to the major connector. Third, they join the denture base to the major connector. And last, they serve as an approach arm for a bar type of clasp assembly. So let us discuss them one by one. So the first type of the minor connectors are which join the clasp assembly to the major connectors. First of all, they should be rigid to provide a rigidity to the framework. Second, they mainly support the rests to prevent the vertical movement towards the tissue. Third, they are located on the proximal surface, as we can see in the picture also. Then if we talk about the design, they are broad buccolingually and they are thin mesiodistally. Now, if the clasp assembly is not being placed on the tooth, which is adjacent to the edentulous space, then these minor connectors should be positioned in the embrasure area, as we just discussed in the design also. They should be located in the embrasure area between the two teeth, so they are least noticeable. Second type of minor connectors are which join the indirect retainers or the auxiliary rests to the major connector. These type of minor connectors, they arise from the major connector and then they connect to the rest, say. area. Okay. Second, they always form a right angle with the major connector, as we just discussed, that the gingival crossing should be abrupt and they should cover as little gingival tissue as possible. Third, they are designed to lie in the embrasure area. The reason is the same, that they should be least noticeable to the tongue, so they should not be located on the convex surfaces. Now the third type of minor connectors are which join the denture base to the major connectors. They must be strong, they must be rigid. Then for the maxillary arch, they should cover whole of the ridge till the tuberosity, and for the mandibular arch, they should cover 2/3 of the edentulous ridge. So as from the picture, we can make it out that these type of minor connector will be present on the saddle area, on the edentulous ridge area, which will connect to the denture base. Now, depending on the design, these can be of three types. First is the lattice work construction, second is the mesh construction, and third is the bead wire or the nail head minor connector. Let us discuss them briefly. First is the lattice work construction. In this, there are two types of struts, the longitudinal struts which are present buccal and lingual, and then they are connected with the small connecting struts to form the lattice work. Okay, relief space is given below this lattice for the acrylic denture base. This lattice will be incorporated into the resin. This is mainly used for the multiple teeth placements. Okay, the advantage of this type of design is that it provides the strongest attachment with the resin, as there is complete locking of the acrylic resin which provides retention of the denture base. And second, they are easy to reline in the excessive ridge resorption cases. Second is the mesh construction. In this, a thin sheet of metal with multiple small holes are used as a minor connector. Mainly the wax mesh is used to form the minor connector, and then the casting is done to obtain the metal sheet. Now, second, relief space is always given below the mesh so that to incorporate the acrylic denture base. It is mainly used for replacement of the multiple teeth. The advantage is that enough space is present for the teeth arrangement because it is a metal thin sheet-like structure. It is not the struts like the lattice work design. Then the disadvantage is that it is more difficult to pack the acrylic resin dough because more pressure is needed against the resin to force it into the small holes of the mesh. And second, it does not provide as strong attachment for the acrylic denture base as compared to the lattice framework. Third is the bead wire or the nail head minor connector. In this, there is a metal denture base with the metal projection. So there is no acrylic base here. The difference is this, and the projections are beads, wire or nail heads which provide the retention. So as there is no acrylic, so no relief is provided. Okay, the uses where the inter-arch space is very less. Okay, there we go for the bead wire or the nail head minor connector. The major shortcomings are, first, it is difficult to adjust because the metal is touching the tissue and it is very difficult to adjust the metal. Then it cannot be adequately relined because there is no acrylic resin. And third, it provides the weakest attachment amongst the three with the acrylic on the metal denture base. Okay, now these are some of the MCQs are also asked, like which is the weakest attachment, which is the strongest attachment, which minor connector is used when the interarch space is less. Tissue stops, very important. Tissue stops are the metal projections which are at the distal end of these type of distal extension minor connectors. Okay, when the minor connector is on the saddle area. What is the function of tissue stop? That they provide stability for the framework during the stages of transfer and processing of the denture base. Now the size of the tissue stops, 2 square millimeter of relief wax is removed so that it will be obtained as a metal projection on the distal end, which will give us the stability to the minor connector. The fourth type is the minor connector, which serve as an approach arm for a bar type of clasp. It is the only non-rigid minor connector. Another important multiple choice question. Second, it supports the bar clasp, as we can see in the picture, that approaches from the gingival margin. So it has to go into the undercut area. So it has to be flexible, non-rigid. But it must not cross a soft tissue undercut. Okay, so this is all about the minor connectors. So that's all for this topic. Thanks for watching, my dear students. You can give your topics in the comment section, and do not forget to share and like the video with your friends and your juniors. Wish you success today and always.